Dr. Turab Rai here from Franklin.DentalCare and Dentures. Today I wanted to go through some of the signs and symptoms and honestly disease progression that happens when we become pregnant. All of us have this beautiful gift of bringing life into this world. And a lot of the time we take that gift for granted because we take our bodies for granted, right? The average person is better at taking care of their animals than they are themselves. And when it comes to having another human being in our life, financially, spiritually, vision-wise, it changes everything, and our health changes a lot too. When women get pregnant, these are some of the signs and symptoms that change in the mouth. So gingivitis is the tendency for inflammation to increase in our mouth. And what that means is our gums get a lot more sensitive, they're more easy on bleeding, they start poofing up a little bit, they change color, they get a little darker. And so the idea is that when you have all of that inflammation in your body, it's going to feel like your teeth are going to shit. But the reality is increased brushing technique, increasing an understanding of flossing mechanics and making sure to do that more consistently when pregnancy kicks in can help mitigate some of those issues with gingivitis, that gum bleeding and the sensitivity. On top of that, a lot of people get these like little bumps on their gum over here, okay? And they end up bleeding a lot. And I want you to know that that's normal in pregnancy. And it happens to women a lot, considering there's also a drastic change in acidity in the oral environment when women get pregnant. And that causes not only the teeth in general to be more sensitive and also break down a little bit more because of our eating habit changes. So you might be thinking, oh my goodness, what did I sign up for here? You know, I want you to know that when we give a gift in the universe, it comes at a cost, okay? And at the end of the day, if we know how the symptoms are going to be shown and how the disease is going to progress, then we know the things that we need to do to better that. So acidity-wise, I always tell people that your oral health consists 50-50 of nutrition and hygiene. And the reason is because these bacteria, they end up occupying all these little nooks and crevices in our mouth. And so every time we eat something, these bacteria, they eat it too, and they produce all of this acid. And it happens 30 minutes into us eating. And that acidity continues for a little while, and then it settles down about an hour later. And then it's our job to not continue to snack, which during pregnancy tends to be an issue because obviously women have these cravings, you know, that, oh, I want to go out and get this food, and I want to snack on this, and I want to have my favorite drink, and I want to... And having all those snacks in your mouth all the time does not help gingivitis because those bacteria are still going to continue to break down all that food in your mouth and make it so that really the environment is not conducive to necessarily healthy teeth, right? But that's habit-based. It is a little bit body-based, but a lot of it is habit-based. And you can get out of pregnancy without having a lot of dental issues if you just keep your habits and your nutrition straight. So have those cravings and have those meals, but spend 4-hour chunks of time where your saliva can get away that acidity in your mouth and actually make it so that your teeth can heal up. Tooth erosion, you get dry mouth. A lot of dry mouth from that acidity, probably from that morning sickness. Saliva in general tends to be used quite a bit to make sure that our body is healing really fast. So dry mouth actually contributes to a variety of different issues in the mouth. And one of the main ones is a lack of healing, but also a lack of nullifying the acidity. And so the saliva actually has enzymes in it that help us heal. That's why when we get a tongue bite or when we get a cheek bite, it heals literally within the day and we don't even feel it anymore. It's because those enzymes in the saliva actually heal up that tissue really, really fast. And so it's our responsibility to make sure that we have ample amounts of saliva in the mouth. Smoking contributes to a lack of saliva. Any amount of prescriptions limit our saliva. Sleeping with our mouth open limits our saliva, and sleeping with our mouth open comes from a lot of different factors. First of all, I always say, always blame yourself before you blame everything else in the world. And so what I've tried and I've succeeded in doing many times is I sleep with my mouth closed, and I try to very consciously sleep with my mouth closed. After a while, it starts turning into a habit. But if you have some sort of skeletal issue from birth, or from the use of a pacifier too much, it can lead to sleep apnea, which in itself requires some sort of intervention through a dentist or through an oral facial surgeon to make sure that we have enough space in the back of our throat to actually breathe properly, and that we don't need to have our mouth open to breathe. And so these things exacerbate, okay, there's a lot of signs and symptoms prior, right? Obesity, diabetes, hypertension, all these things that are prevented through really just taking care of yourself on the daily. Those are all exacerbating this gingivitis, these caries, this dry mouth in pregnancy. So going into pregnancy healthy will lead to getting out of pregnancy healthy. But if you're in the process and you're just watching this video and you're like, dude, my teeth are going to shit and I don't feel very good, it's probably time to start thinking about some habit changes and some eating and brushing changes in particular. I made a whole video about how to brush your teeth. You want to go 45 degrees down into the gums, okay? You want to go in here and you want to go 45 degrees down. And the idea is those pits and grooves, those little spaces that the bacteria are in, you want to be able to get those guys out, and you want to make sure that you keep it at a normal level. Also, right down there, behind my front teeth, that's where I find most people have a lot of buildup, a lot of plaque and calculus. So before pregnancy, in the couple months before it really starts taking off, go to your dentist and say, hey, can I get a cleaning, right? Can I get an assessment? I want to make sure that this pregnancy is healthy and happy. Can you give me some tips and tricks on how to do that so that my teeth turn out good on the other side? So clean up all the disease prior to going into pregnancy, and then your symptoms and factors will be a lot better. When we have calculus and stuff caked onto the backside of our teeth, or places that we didn't really brush, and then we go into a situation where inflammation, gingivitis, cavities are going to be increased, we're really setting ourselves up for a bad situation. So definitely go and check out a dentist. Franklin Dental Care and Dentures here in Franklin, Ohio. We take Medicaid care source. So if you just got pregnant and you haven't taken care of your oral health and you're watching this video, come on down and we'll help you out, and we'll give you all the advice to have a healthy, happy baby. Furthermore, so as it turns out, there's a lot of studies that are being conducted now about how periodontal disease and gum disease actually affect the rest of our body. They affect lots and lots of things in men, and they affect lots and lots of things in women. And it should be assumed, and because of studies that have shown, it actually affects the oral health of our children as well. And so I want you to think about your life and your body, instead of just you thing, it's actually a whole system of organisms. It's actually a whole bunch of bacteria, your gut health, your mouth health, your brain health, it's all connected. So if there's any part of your body that's not healthy, it would behoove the wise practitioner of prevention to say, hey, I should probably make this thing healthy, and just watch. Spending the time and energy to make one thing healthy in our mouth, in our body, actually changes the way the rest of the body functions too. It's all interconnected. The blood is flowing all the way through our system. It's going all in here. It's going to our brain, you understand? So all these bacteria, they have a chance to move around in our body, and obviously that has an effect on little things that we don't even think are important. So spend the time focusing on prevention so that you can teach that kid, that beautiful kid that you're going to bring into this world, what it means to really care and love oneself. I'll see you here at Franklin Dental Care and Dentures. This is Dr. Turab Rai. Take care.